Can you hear me?
Yes, please, please proceed.
Delegates of the World Health Assembly, greetings from St. Vincent and the Grenadines. The world is dealing with the most serious public health challenge in living memory. The COVID 19 pandemic has basically affected every corner of the globe with impacts on health and the economy. It is affecting lives and livelihoods. I never thought that I would see pictures of an empty JFK airport, the UK in lockdown, and health systems the world over under siege. But that became our reality in the 21st century. Right now, we are all basically marooned in our own countries. This pandemic has taught us that we don't have a developing world and a developed world or anything like that. We have one world, and we are all in it together. St. Vincent and the Grenadines has not had any cases of COVID 19 for over 14 days since May 3rd. We have had 17 confirmed cases overall, of which 14 are recovered and 3 are active. There have been no deaths and no health worker has been infected. In response to COVID 19, St. Vincent and the Grenadines implemented a raft of social and public health measures to minimize the spread of the disease. It is impossible to recite all these measures in a 2-minute statement. However, our strategy can be summed up in a few short lines. 1. Finding cases and isolating them. 2. Taking special precautions with high risk groups, such as travelers and exposed persons, because they might be cases. 3. Providing appropriate clinical care. 4. Applying general and specific infection control and prevention measures as guided by the science. Fighting COVID 19 is like fighting a fire. We must go after it aggressively and snuff it out. We never had to resort to full scale lockdown. We didn't impose curfews or close our borders and airports. Naturally, travel activity was curtailed by the suspension of commercial flights. We built our response on the foundation of public trust through advisories and appropriate actions. We have been managing risk with the aim of maximizing the health, freedom, rights, economic, social, and other benefits to the population. Our response was affected by the disruption of supply chains and trade restrictions. It took us 2.5 months to get a PCR machine, and even the International Atomic Energy Agency, for all its good intentions and explosive might, seemed powerless to help us on this matter. This raises many certain questions. Fortunately, we were able to do tests at the Caribbean Public Health Lab located in a nearby country using regional security aircraft for transportation of samples. We had to deal with complex matters such as the repatriation of Vincentian employees who were abroad.
Honorable
This process
Minister,
is
we would
ongoing.
kindly ask you to
We thank
conclude.
God for everyone who came to our assistance, our development partners, the Caribbean Development Bank, the International Monetary Fund, the World Bank, and the United Arab Emirates stood by us. Cuba sent doctors and nurses for our isolation center. Venezuela provided supplies and rapid test kits, even though that country is still being subjected to sanctions and political adventurism at the time of COVID 19. Imagine that. Taiwan has emerged as a shining example to the world in terms of response to COVID 19 and has provided assistance to many countries, including St. Vincent and the Grenadines. But it is still locked out of the World Health Assembly. Imagine that. This matter must be addressed and resolved in a satisfactory
Honorable
manner
Minister, we
in
would
the
kindly
interest
ask you
of
to
global
conclude.
health. Taiwan can help. The Director General of the World Health Organization is fond of saying that the antidote to COVID 19 is national unity, global solidarity, and the human spirit. I agree with him. We are in tempestuous seas, but we could summon to our assistance the following refrain from a popular song of faith in our country. With Christ in our vessel, we could smile at the storm. We will beat the coronavirus pandemic together. We are looking forward to the development of vaccines.
Thank you very much, Honorable Minister.